this much, like it can be reduced a bit, and screen can be increased a bit
Yeah,
in screen
correct.
size. This much, like it can be reduced a bit, and screen can be
I think we are
increased a bit
live
in
now.
screen size.
All right. I think we are live. Okay. Okay. Right. So, hello and welcome everyone. So, we are doing this session on the same night that the NEET SS 2025 examination has been conducted. And I'm sure that at this moment it must be a mix of feelings for the candidates who have given the examination. Some of you might be relieved, happy that the exam is done with. Some of you may not be that happy. Maybe you might not have given, uh, performance to the level that you have expected. And well, what we would like to convey to you upfront is hats off to the effort that you have put in over the last several months. And in a vast subject like medicine, it's not possible that you master all the subspecialties, and especially in an unpredictable paper pattern like National Board of Examinations. They keep surprising you every year, and this year also they have surprised us. And if you remember, in the session that we actually did 2 days back, there is something that I told you: anticipate a crisis, which has happened in many of the NEET SS examinations. So, upfront, what we would like to tell you is that, in fact, you are the guys who have taken the examination, and the insights that we are sharing with you is just an amalgamation of the data that we have collected from all the dear students who have actually given the exam. So, first of all, talking about the big surprise that actually happened in this examination, much expected, much more than expected number of questions came from the environmental emergencies and toxicology. And in case you have done that particular system well, I think you are likely to score uh, here again. But some of the questions, even in those topics, appear to be a bit vague, because we are just getting the entire recall from the students, and we are also just preparing the slides as well. But very good number of questions actually came, and I feel that that might be one rank deciding area for the current NEET SS examination. And also good number of questions came from oncology. This is again something that we have stressed to the students, that oncology is a separate paper, but do not neglect oncology for NEET SS. Is something we have told you time and again. I know that for many of the students, this might have taken them aback, maybe during the examination, where you actually saw one block, almost having so many number of questions from that single topic of environmental emergencies. Okay, so that might actually appear a bit unfair to you as well. Okay, and at the same time, I should say that there were quite a decent number of questions which were easy or easy to moderate. Some of the questions even at a NEET PG level as well. For certain topics like celiac disease, I think you had 2 or 3 questions from the same topic as well. So this is what we just want to start off with. Okay, what as an outsider, I'm just looking at the general feedbacks of the students. So overall, it is of a moderate difficulty level, moderate to tough. And if you ask me to compare with the previous the NEET SS examination, I think you will have to just wait for one more day, because we are collecting the entire the structure of the question, because we need to get the options as well, because only then we'll be able to tell you a firm idea on how the cutoff is going to change. But we'll have a preliminary impression here. I think Dr. Karthik has also made a presentation here to just share with you based on the questions asked for this examination. So, Karthik, over to you. And what are your initial impressions on this examination?
Yeah, Rahul sir, just like you told, it's always a tricky situation doing the first impression analysis on the NEET SS paper, because the different set of students will be having a mixed feelings. As you told, some of them might have done up to the expectation mark. Some of them may feel that they might have left out a few questions out there. And as you told, it always throws up with some surprises. It was genetic questions back in 2022. Then there was a lot of DM exit level questions in 2023. Then it was rheumatology with around 30 questions back in 2024. And now it was the overwhelming number of questions from the toxicology. And thankfully, as Rahul sir has told, these questions, the environmental emergency question and toxicology, had appeared in the third block, if I'm not incorrect. So the students have already done with the core medicine specialty paper, and otherwise, I think the this environmental emergency question appearing as the stage one or the block one would have rattled most of you. But thankfully, at least it was in the latter part of the exam, which could have done a bit of benefit for the students. So I think with this, what we've been planning to do today is to say how the question pattern now in this session has been different from what we've been seeing in the last few sessions, and the question distribution across the specialties, and what major changes that we have observed in the question pattern compared to the Asterias pattern, and of course, dealing a bit more about the major change, which is the questions which had appeared in toxicology and environmental medicine. So these are our Instagram IDs, Rahul
Instagram,
sir, please.
and just want to tell all of you that in case you're an aspirant who has just given the exam in the first try, and you're not there in the WhatsApp groups of DocTutorials, we have got active WhatsApp groups as well. So these are our Instagram IDs. You can send me a personal message in Instagram as well. The ID Dr_Rahul_Rajeev. So I'll just message you the group ID as well, the link of the group for the NEET SS examination, and for subsequent exam discussions, recall videos, we'll be updating you in that group, so you can send a personal ID to me, a personal message to me in Instagram. Okay, right. Dr. Karthik, over to you.
So we'll be going through the following points in the next 20 minutes or so. One is about the difficulty level of questions, which Rahul sir has already spoken to you about. Second, the question pattern. What was the major patterns? How many clinical-based questions were there? How many long clinical questions, image-based questions? Our insight on those. And what about the specialty-wise question distribution? How much questions had come from each specialty? Because it gives you a guidance, especially for those who are going to appear and for this, the upcoming batches of students who are going to watch this video. This would give them a pretty good idea about which are those specialties where they have to keep specific interest upon, and also the high yield areas or the sections from which the questions have come this year. And also, almost every year we discuss this point, and was this paper really a Harrison based one, or was it a general paper with a lot of guidelines and outside specialty based papers as well? Okay. So Rahul sir, the difficulty level of questions.
Yeah, I think we have taken a poll as well in the WhatsApp groups, and what we understand is when we actually categorize the level of toughness into easy, moderate, moderately difficult, and difficult, most of the polls have been in favor of moderately difficult. And I think most of them who actually felt it to be on the slightly difficult level must have been students who might have not been comfortable with these many number of questions from the environmental emergencies, because it seemed to me that other questions, most of them were, from what I saw, I think expected and pretty answerable as well. I think it is very important not to make mistakes in those questions. See, what you have to understand is today's unpredictable paper was the same for everyone, and I don't think there is anyone who has actually guessed that these many number of questions will come. Even I knew that okay, this is an important topic, but this was a surprise to me as well that these many number of questions have come from this topic. So that's it, what I want to tell you. Do not worry too much. I hope that whatever questions you have attempted, you have given a fair performance in that. Yes,
So
over to you.
again, this paper is like is just an example of how vast, yeah, how vast the subject can be. Because a paper can be difficult in two ways. One, the question can come from expected area, but in a greater depth. Just like in the 2023 paper, where many of the questions could be answered only by a person doing a DM residency or in a DM exit exam. So very in-depth concept checking is one type of difficult paper. And then you can have the questions from every nook and corner of the textbook, even from the topics which you deem as not so important. So many questions from unexpected areas like toxicology and environmental emergencies, and that could also tilt the difficulty level into a moderate to tough questions. That is exactly what has happened in this paper. And when I was going through all the questions from the core specialties, be it endocrine, rheumat, neuro, nephro, gastro, cardio. So most of the questions were actually like easy to moderate in toughness. Whereas I think the overall skewness regarding the toughness of the paper had come from the questions. Because of the questions, there were so much in abundance from those areas which you didn't expect. So this will be clearer once you go through the individual subject specialty distribution. So we've been doing this specialty wise distribution of questions for the last like 2 to 3 sessions now. So Rahul sir, now this isn't a broad classification of the number of questions from each specialty. Again, there could be some overlap. Some oncological questions could come under the oncology or from the respective specialties like was, but this is in general in which I could categorize the 150 recalls this year.
Right. So it looks, slightly skewed towards the environmental medicine, but otherwise, if you see, decent number of questions came from other subspecialties as well. But again, we would expect around 20 plus for neuro, endocrine, cardio, but I think they have taken a bit of place to accommodate all the, the environmental medicine questions that they wanted to ask. Okay, right.
Yeah, again, one like two star difference from the last year was rheumatology and gastroenterology was contributing around 25 to 30 questions each last session. Whereas when you look at the core specialties like the neuro, gastro, endocrine, infectious disease, cardiology, all were having questions in the range of around 15. So more of an equivalent distribution among the core specialties. But as we have been discussing, it has been skewed towards that toxicology, environmental medicine, critical care, almost contributing to the 50 question mark. Okay, so next up, we will be moving on to the important areas from each specialty. So you might have already seen that around 18 questions had come from endocrinology. But one thing which I had noticed is that most of them were straightforward. And one, even if you didn't have a very in-depth reading on endocrinology, just by watching the QRP videos and solving the Q bank, I'm pretty sure you'd be able to score at least 16 out of the 18 questions. There were two questions from pituitary. I think this pituitary questions caused a bit of confusion because the question on pituitary macroadenoma was that of a non-functioning adenoma with stalk effect and minimal prolactin increase. So it is not a case of prolactinoma. So the answer could be surgery and not the cabergoline therapy. So that is the only like bouncer you had as far as the endocrine paper was concerned. The second, central hypothyroidism, straightforward question. There were 4 or 5 questions on the disorders of ADH, two very easy questions on the SIADH with the small cell lung cancer and the treatment in those who are not responding to water restriction, which is Vaptins. Then 2 questions on diabetes insipidus. In pregnancy, you treat it with nasal desmopressin, which is not cleaved by the enzyme. And the lithium-induced nephrogenic DI, you don't use acetylcholamine because it worsens the osmotic diversis. Again, I'm not using this platform as a detailed recall session for endocrine. We'll be doing a separate recall session. All this faculty will be doing the sessions later on. So here we'll be just going through the questions and highlighting the important areas from which the questions had come. So with the adrenal, 1 question each touching the major questions. 1 question from FIO, one from primary hyperaldo, and one from Cushing syndrome, that is ectopic ACTH. Nothing outside from what we have discussed in the QRP and the revision sessions. Thyroid, again, 2 questions from hyperthyroidism. One, again, the question which we had itself, the same question we had discussed in the clinical case situations in the thyroidology under the long video session. And myxedema, coma, we had learned that the warming is used by the cooling blankets and all, which is the passive rewarming. And I've always told you, bone mineral metabolism is a very important section in endocrinology, and 2 questions had come related to osteoporosis. Again, both the points we had discussed in the videos, and again, the SHBG, the carcinoid syndrome due to small intestinal intestine, which one of the points we have discussed in the last minute discussion in the WhatsApp groups as well. And porphyria without photosensitivity. Again, we had posted a PDF file on the important one-liners in porphyria, which itself had this important point. So I think a very high scoring points from endocrinology, almost 90 to 100% of the questions could be scored under endocrinology in those who had a sound reading of the subject.
Yeah. So Karthik, I think at the first
So
look,
next
it
up,
seems that
Rahul. Yeah,
yeah. So at the first look, it seems that endocrinology, most of the questions that came were actually from expected topics. And from what I understand is, though the paper was slightly skewed towards environmental emergencies and all, it all depends on how well you have performed for the other systems. Because tough questions from environmental emergencies,
absolutely.
maybe many candidates would have found it difficult. So I think it's important to get these questions correct.
Absolutely, sir. And now over to your specialty, sir, neurology.
Yeah. So neurology, I think this is just a segregation based on the questions that I've just got. So from the topic of demyelinating disorders, I think there was one question being asked. Then question based on natalizumab, again monitoring. This is expected question, and there was an image of the MRI of the spinal cord. Again, I'm just collecting all the options for it. And what I understand is the patient has got some sort of a weakness, and they were asking about the etiological diagnosis in that particular case. Regarding atypical Parkinsonism, I think two questions came from the atypical Parkinsonism topic. One was a straightforward question on multiple system atrophy, which, according to the students, had the exact image of the hot cross bun from Harrison. Second, there was a question on the corticobasal degeneration as well, which is again a clinical scenario based question. Then there was a question on the FSHD and the classic image of the polyhill sign. And they were asking not about the diagnosis, but about the true statement regarding that was asked. And Hasbled is something which we have discussed in our lectures. We have discussed in Elite test and discussion. And the component of Hasbled scoring system was actually asked. I think there was one question on NMO spectrum disorders as well. Please correct me in the chat box if I'm mistaken. I think there was one question is what I understood from the students. Then question on aphasia. As always, the topic of aphasia is important. And another question on nutritional deficiency, post-gastrectomy, peripheral neuropathy, patient with nystagmus. Again, expected question. And one question was on the repetitive nerve stimulation in case of botulism. And I just need your input regarding this. Was it regarding high frequency RNS or low frequency RNS, or was there no mention like that? Was it simply asked RNS? Please give me your inputs in the comment section as well. Then a question on the patient with an acute stroke. Though the NIHS was on the lower side, what I understand is that the patient had a significant functional deficit and there was an evidence of proximal MC occlusion. If that is the case, it has to be thrombolysis followed by thrombectomy, which most students said that was the option that was provided. Then a question on trigeminal neuralgia, and then a question on the genetics of Huntington's as well. So these are the questions, what we could actually gather. And then there was a scenario-based question on the logged-in syndrome as well. So these are the topics that I've actually gathered. We'll be doing a detailed recall video very soon. So stay updated in the group. We'll be doing individual subject-wise recall videos soon as well. Yes, Karthik, over to you. So overall, it's
So I think
basically
Rahul, sir, I've yeah.
expected areas question have come. No, you cannot say that any of this is difficult. So I think it's important that you actually strike well in these questions. Okay.
And one interesting point, sir, there were no questions from the epilepsy or anti-epileptic drugs. And I remember one of the NEET SS sessions, I think around 7 or 8 questions were from epilepsy
And
in one
around, I
of the
think,
previous sessions.
3 questions out of those were from anti-epileptic drugs per se. Okay, but 0 questions this time. Okay.
Yes, yes. Just like in endocrinology, there were no questions from diabetes mellitus this time. We had around 4 questions last time, no questions this time.
Okay.
Yeah, again, gastroenterology always on the high scoring side, like previously also close to 15 to 20 questions last time, 25 to 30 questions last time. Now here around 15 to 20 questions this time. One major difference which we had was there were less of image-based questions from gastro this time. Usually there were a lot of like endoscopic images, MRCP, ERCP images, which had come in the previous years, but less of image-based questions this time. And the questions on viral hepatitis is also on the lesser side. There were just one question from hepatitis B serology where we had to identify the remote infection based on the serology. So almost equal number of questions had come from the gut and from the liver. In the gut, you had the like the one of the stomach mass, which was an image-based question. Then question on Whipple's disease. As Sir told, there were two questions, straightforward questions on celiac disease. Again, very simple questions from small intestinal bacterial overgrowth, the setting of scleroderma, and ulcerative colitis patient presenting with digital ischemic ulceration. And in liver, again, there were no like googlies or bounces, straightforward questions on Gilbert syndrome case scenario, hemochromatosis. The case scenario was given, you were asked to mention about the treatment. Then telomeropathy, where the patient was found to have cryptogenic cirrhosis and multiple family members with pulmonary fibrosis, thus helping us reach the diagnosis. Then again, a young person with primary biliary cirrhosis, the scenario and the details were given. Hepatic encephalopathy, those points which we will be studying even for NEET PG, hypokalemia worsens hepatic encephalopathy, that point was asked. And how do you manage a case of drug-induced liver injury induced by anti-tuberculous therapy was also asked. Then 2 points, slightly confusing options as far as the nutrition was concerned. The use of jejunostomy in a patient with delayed gastric emptying and not tolerating liquid foods, and a question on the RT feeding as well. So one question, overlap question from both GIT and rheumatology, was the association between autoimmune pancreatitis and retroperitoneal fibrosis. Again, it is a true-false statement. Doesn't go to the in-depth of the statements in Harrison. Just an association between the AIP and the retroperitoneal fibrosis. Any knowledge about that would fetch you the answer. So overall, sir, looking into the gastro paper, again, it's quite a doable paper, slightly easier than the last year questions is what I feel, because last year they had so much of questions from like viral hepatitis. Some of them were very confusing also, and the gut based questions was slightly on the difficult side last time. Compared to that, definitely this is easy to moderate is what I feel.
And Karthik, based on the questions that we have discussed so far, don't you also feel that there are a decent number of NEET PG level questions like that we would actually expect at a NEET
Absolutely, sir.
PG level, right? So I think it's important, for the future aspirants as well, that don't neglect the easier topics and straightforward ones, because sometimes, in the heat of the moment, if you have not revised them, you can get it wrong.
And so one point which we have noticed is that many of these questions may appear to be a one-liner, but in fact it had come in the form of a clinical case scenario. But again, all the cardinal features were given, and there were not a lot of diagnostic confusion. Even though it was a clinical case scenario, it was not a very long scenario and with very close options. These scenarios from the core subjects were often like non-confusing and easier to crack, is what I felt. Yeah, hematology. Again, we would expect around 8 to 10 questions from hematology, and that is what has happened with majority of the questions coming from the RBC disorders. We had questions from the warm autoimmune hemolytic anemia. What was the antibody type? Case-based scenario on thalassemia. One question on normal hemoglobin structure and a hemolytic disease of newborn. Again, nothing from what we don't expect. And in platelet disorders, also one straightforward scenario on acute ITP and polycythemia vera. This is a previous question also. It is a pan-myelinosis disorder and thrombocytopenia is not seen. Then again, a case-based scenario on poems. Again, the questions and the pattern from the areas that we often discuss and expect from.
Karthik,
And
just
there was
also
one question
something.
from lymphoma also. Yeah. Yes.
No, I was just actually telling, I know that some of the students who are listening to this recall, maybe they had a very bad day. Okay. Let's assume they had a very bad day, very bad day. They did not actually give the exam well, they have messed up their exam. I just want to tell you that, see, we're just closing on December now. NEET exam result has to come, and then the counseling has to come. So let's assume that the course starts in like, say, March or something like that. see, what is eventually going to happen is that in another 1 month you also have the INISS after that. Okay, so if there is a candidate, totally distort after the exam, there is a very good chance that you might go on to crack INI. And I still remember one student, as I speak, I still remember about one student who had exactly gone through multiple examples, but again, I'm just thinking of one student who had a very bad exam and then went to INI, got a very good rank in INI, and now has passed out from a central institute. So if you are listening to me, if you had a very bad examination, who knows, you might be destined to study in a central institute. So please don't think that, all the preparation you have done, has gone in vain. At least some of you might feel demoralized, but exams are like that. And NB exams especially, is very, very unpredictable like this. But INI is always a pattern based examination. So far what we have seen is that they usually stick to a pattern. So, please don't feel too much disappointed. If at all you did not go well, there is always a next chance, especially for the upcoming INI. Okay, Karthik, please.
Yes. So again, infectious disease, yet another like high scoring area. Like usually we expect around 15 questions from infectious disease. That is exactly what has happened this time also, with a good mix of questions from bacterial, viral, HIV. And as often it happens, like bacterial disorders usually comes from the atypical organisms. You had a few questions from Brucella, from two questions from Bartonella, the cat scratch disease management, then some of the microbiological aspect, some questions that we usually see in a NEET PG microbiology paper, like the safety pin appearance of bacteria and your ability to relate to melioidosis and how do you treat. Wet hay order, again, pulmonary nocardiosis, again, these are pretty much the questions that can have like come in a slightly more difficult NEET PG paper, and the question pattern was also framed in such a way whereas there are not too much confusions, they were straightforward with not of lot of twisting and all. But if you know that particular one liner point, then you would be able to crack the answer. Then a question on HLH, secondary to dengue fever, IMN like illness management, and how do you diagnose a recent infection with cytomegalovirus. Again, all questions from the expected lines. The two questions from HIV, one on the blood and thunder fundus, referring to CMV retinitis and how do you manage that. And in a patient with HIV, oral candidiasis and tuberculosis, what would be the staging of or the stage of the HIV. Then one question I still remember, like Rahul sir teaching me when I was my third year MBBS microbiology, spiramycin is the drug of choice for toxoplasma in pregnancy. Again, a very, very favorite question at the NEET PG level. Yes,
So
sir.
overall,
Any
I think
comments from your
ID,
side, sir? From
I think has always been one area where you've had a decent number of questions, and I think fair enough number of questions, not too much, but again fair enough number of questions from infectious diseases, and I think a good percentage of which is answerable by a candidate who has seriously prepared. But in case you have not prepared very seriously, some of these questions might seem tough to you as well. So it depends, how well you have prepared for your exam.
And sir, one point, sir, this was this paper seemed more like a textbook based paper rather than a guideline based one, because in the previous years we had so many algorithms which were not there in Harrison, which were asked. Recent like vaccination guidelines were asked. The newer like updates, the tuberculosis and the HIV treatment were asked. None of them. These are all standard theory points which have come in the form of like one-liners and clinical case scenarios.
Correct, correct. Absolutely right.
And yet from cardiology, I think cardiology, one of the surprises which was thrown up this time was the number of questions which had come from arrhythmias. See, almost all the ECG based questions had come from arrhythmias, both tachy and bradyarrhythmias, and surprisingly that were not too difficult. Like you had the question on broad complex tachycardia, patient with stable vitals, how do you manage? Patient with supraventricular tachycardia, how are you going to manage with the help of adenosine? And how do you plan a long-term management in advanced second degree block? A patient with acute atrial fibrillation with controlled ventricular rate within the first 72 hours, what is the drug that you will add? Has blood score, I think I've added has blood under cardiology than neurology. this time. And the Brugada pattern in ECG with family history of sudden cardiac death. Then all the expected questions, the NEET PG level questions on aortic dissection, which is the investigation of choice, a straight one-liner from Harrison. Hydralazine drug is absolutely contraindicated in aortic dissection, and which is that antiplatelet that you avoid in elderly with history of TIA or stroke. Again, prasugrel. All these are straight one-liners from Harrison. And again, cardiomyopathy and heart failure. They had gone through that five pillars of heart failure. If those patients had developed hyperkalemia with an ACE inhibitor or ARNI, what is the next best agent that you can add? You had the isosorbate mononitrate plus hydrolysine combination in the option. Then a patient with biatrial enlargement and right heart failure symptoms, which indicates the restrictive cardiomyopathy. Again, more or less in the expected line, sir, for cardiology. What do you say, sir?
Yeah, and but I think also this time usually they do ask questions based on heart sounds, JVP, pulse, but that is actually missing from the list. In the first instance, I've just gone through it. So cardiology, the topics
Only one
that have
point,
been
sir. The
asked,
restrictive
yeah,
cardiomyopathy had mentioned prominent wide descent. That's all. That's all. Apart from
okay.
that, there were no questions from bedside cardiology.
Okay, so may not be an even distribution, but the topics that have been selected are important topics, and some of them, this aortic dissection, both the questions are NEET PG level questions, correct? No, so that's what I hope this time.
Yes, sir.
These questions are also going to be rank deciding. You should not make a mistake in these questions. That's what I hope for.
And so when I was going through the students' responses from the messages that I've got, and on referring back to the many GTs and QBank questions, sir, I was really surprised. I was thinking about the comment that you have made in our the session that we have done 2 days back. Like, will the questions, more of the questions will be coming from the DocTutorials GT or the QBank? One of the students had asked, and I think many questions, like students have
Yes,
started posting the screenshots of the questions
yes.
also, and
That is what I am also
many
thinking.
of them, they're ditto.
It was a coincidence. Like many questions, almost the same question actually came from the GT, which is again a pure coincidence. But anyway, the students who have actually gone through them were actually lucky. That is what I should actually tell. A lot of questions came from the doc tutorials GT. Some of them which were exact. This is what we got to know from the students. Those who have given the exam. You are watching the session. You might have actually seen those who have. I've had students who have given almost every GT, and many of them actually messaged me as well. They were lucky to get some direct questions from the GT as well. Okay.
And one of the mitochondrial complex abnormality that occurs with aging, it is very unlikely that a student would go through that exact point in the Harrison. But because it has come in a GT, most of the students have
Absolutely.
answered them correctly.
Absolutely. Absolutely.
Yeah, rheumatology, which was the golden boy last year with around 28 questions. Now, still a good number of questions, around 10 or 11 questions had come from rheumatology. Surprisingly, no questions from rheumatoid arthritis. Last time there were around 5 or 6 questions from rheumatoid arthritis. Again, here, no questions from rheumatoid arthritis, but 5 questions from connective tissue disorders. Again, APLA syndrome, what is the choice of drug? Every NEET SS will have a question on APLA syndrome, the management. This time also you had one. Then questions on the expected lines, periuncal telangiectasia. Again, I think this is the third time in the last 5 sessions they are asking about periuncal telangiectasia and also the Gottron's papule in dermatomyositis. Every paper will have a question on that. Then lupus nephritis management, scleroderma renal crisis. Rahul are always emphasize about the antibodies in SLE and scleroderma. This time also we had a question on that. Then hepatitis C, cryoglobulinemia skin lesion, then IgG4 related disease, Gottron papule, vasculitis, the giant cell arteritis. I think all the questions. I think a student who has read well enough in nephrology part would, in rheumatology, would be able to answer all the questions. Is what I feel, sir.
And especially for a seriously preparing candidate, since there were a lot many questions from rheumatology last time, I'm sure everybody would have given some extra emphasis to topics like rheumatology. I think they could have got most of the questions right as well for this particular segment. Okay. So some student is asking in the comment section whether we'll be doing a separate session for the uh, upcoming NEET SS for the preparation strategies. That definitely we will be doing later in the same YouTube channel. So you can follow this YouTube channel as well. Okay. Right. Right. So yeah,
And nephrology, I think this is one a topic which perplexes me the most, because this is one consistent thing which has happened over the last few years. The nephrology having very less number of questions. Of course, I agree that many of the overlap questions, uh, like if you put cholesterol embolism, you can include it under nephrology. You may include like the ADH disorders under nephrology also, which the examiners might have thought about it. But the pure nephrology questions, only 5 or 6 I could recollect. Two questions from TTP and HUS asking about the management based on a clinical scenario. They've asked about the chromosomal location of the polycystin 1 gene, again a NEET PG question. Then what are the formula? What is the best formula to measure the GFR in bodybuilders? And of course, like again, so the renal vein thrombosis and membrane nephropathy, again a very classical NEET PG question. So again, here also, sir, the similar pattern has been spread across all the medical core specialties.
And I want to tell all the candidates, those who are listening to this, let's not be too harsh on ourselves. See, if I was in your place, I would not actually spend this much of time for reading environmental emergency. So will Dr. Karthik. So just because such sort of an exam came, and please don't be too harsh on yourself. I think today when you go to sleep, at least you should appreciate yourself for the effort that you have put in over the last several months. Okay, and let's hope for the best. Let's hope that your good result actually comes your way. And if at all you don't get a good results, who knows? You'll get an INI. So yeah, just keep preparing. Yes, Karthik.
And so there were some miscellaneous questions where that I didn't know where to put. Like there were questions from dermatology, psychiatry, some like reproductive endocrine, like I would say like gynecological part, like the pemphigus vulgaris image was given. The question on ego integrity was asked. Then again, a patient asked was identified to have an adnexal mass on pelvic examination. The next step will be an ultrasound of pelvis. Then capsaicin mechanism based on the substance P. I think telomerapathy, there was a duplication. I have discussed this under the gastro section as well. Then the keratin pearls, that a biopsy finding which we associated with squamous cell carcinoma. Again, some of the basic questions which had come. And sir, Rahul sir, do you want to take over this section? A huge number of questions from toxicology. I think almost all the headings in Harrison have been been covered in the toxicology paper, and the question framing is also not so straightforward, unlike many other core specialty questions. And the options were very close. For example, the opioid toxicity question, there were very close options between naloxone, unless one had really gone through the individual statements in Harrison and understood it very well. Otherwise, they can easily confuse between the options also. But I was checking whether all these points were present in Harrison or not. Surprisingly, each and every point which was asked was mentioned in Harrison in one way or the other, directly or indirectly. Most of the questions, I would say, among the last 3 sessions of NEET SS, this one is the most purely Harrison based one. I'm not telling 100% was Harrison, but if you look at line by line, you can see the points or the exam points hiding within and between the lines of Harrison. So for
Exactly.
toxicology, almost all the questions.
In one page of Harrison itself, they have taken 3 4 questions from that. They have just students were also sharing in the group the questions. I just saw that 3 or 4 questions from one particular page of Harrison itself, and quite a good number of questions. And I think here also some questions you will learn at an EPG level, like beta blocker, calcium channel blocker poisoning, intermediate syndrome, scorpion sting. But again, some of the questions, as again Dr. Karthik said, the options were a bit twisted. So we are also waiting for a full structured recall from you guys, because we have got multiple WhatsApp groups. So we are also collecting questions from this groups and then making into a single, proper structured question. Yeah, right.
Yeah. I think there is no point going through the individual toxicities, because all of them, which is mentioned in the Harrison, has been asked in the exam.
Including snake bite,
And
including
there were
snake
questions,
bite.
including snake bites, sir. So, and some of the students were mentioning in the group, they are hearing this specific fish toxicity for the first time in their life, because that was some of the options which have not heard yet in their studies. So in the environmental medicine, some of the questions were in the expected lines, like the vitamin D deficiency, thiamine pyridoxine deficiency, which we had discussed last year also. Then some like basic medical points like the hypothalamic set point modulator in fever. How do you manage the high altitude cerebral edema? What were the points on high altitude acclimatization physiology, the physiology of muscle cramps? So all these were asked from the environmental medicine part as well. And last but not the least, a few questions from critical care as well. I would say not so much core questions from the respiratory medicine. There were no questions from the interstitial lung disease, asthma, COPD, and all. In such a way, that is one specialty which got slightly neglected this time around. But there were a few questions from critical care, and with regards to the management of hypothermia, like the limb polytrauma, how to prevent amputation, in which situation, where will you not use permissive hypercapnia, the CPR on ventilator respiratory rate, about propofol infusion, and the acute lung injury criteria. I think, sir, all of these points were covered in Dr. Mithun's lectures,
Correct.
which was uploaded in the app as well, which very high yield
Correct.
session
And
for the
also even
critical
for
care
the
questions.
environmental emergencies, also he has done a detailed lecture on that. I think which has covered many of those questions that have been asked as well. Okay, and many students also appreciated the QRP lectures of Dr. Mithun sir as well. I think good number of questions came from that is what I understand from the students. Right. And somebody is asking about future preparation. See, what I'll tell you is, if you're asking me about future NEET tests, I would say that you first see the upcoming INI, because we don't know when the NEET test is going to be. So I think you should have targets. Even if you're targeting the next NEET test, still I would say that you give INI, because at least you have an approximate exam date and you have medicine questions for that as well. So I think you have to prepare with a target, because if you don't prepare with a target, because you don't know when the NEET test is going to happen, so I think it's better to have a fixed target. You know that the INI will actually happen in the month of April, so you prepare accordingly is what I would suggest to each one of you. Right.
Yeah. So, and Rahul sir has pointed out the increasing number of questions from oncology. Like if I take some of the questions from the individual specialties as well, I would say the oncology and palliative care would cross more than 10 questions, because the pain management and palliative care has always been a area where you can expect a lot of questions. Last time also there were questions on the titration of morphine, the pain and the analgesic ladder. How do you manage the terminal cancer pain? All these are very favorite questions. And this time also, like you had some questions on the pancreatic cancer pain. How do you manage the lumbar and pelvic pain in patient with metastatic prostatic cancer? Then a question on the risk factors of breast cancer and the predictor of mortality as well. Then there were a few like the PG like questions in regarding the Catherine 1 mutation, where the multiple family members are being affected with adenocarcinoma of breast and GIT, and a CA lung patient with breathlessness and normal saturation. And remember, all these points, I've just cross-checked, all these points are mentioned in like Harrison itself. So again, it is very easy to say in retrospect that because Harrison being such a vast book, you can always now, after the exam is over, you can say this was from Harrison, this was from Harrison. But again, it is very difficult to anticipate how the exam paper is going to be. But at least you have one book where you can refer to, and if there is no need to read these points from any other extra sources. And that is why there are so many questions coming from the DocTutorials GT also, because DocTutorials GT, we like the questions are prepared between the lines of Harrison. You almost are giving this exact same lines which is being mentioned at the Harrison. That is why there are so much of repetitions which is coming. We are not telling that the examiners who are putting the question are referring to our GT and then putting the question for the NEET SS. It is just that we are like thoroughly scrutinizing the Harrison book and framing the questions for our GT. That is why there is such an overlap in the questions in the actual RQ bank and in the final exam.
Right. Karthik, have you done? Yeah.
Yeah. So regarding the question pattern, the number of images this time was slightly on the lesser side. 15 to 20 questions were there, and mostly around 6 or 7 were come from the cardiology ECG side with the tachy and bradyarrhythmias. And there were many other adjunct images which were given, but we had an adjoining clinical history as well. So, though not making it into a purely image based question. But again, around 20 questions is what we can tell is was a definite image based question. And whether it was a lengthy scenario based question, yes, most of the questions, as per the students' recollection, were lengthy scenario based, but not too lengthy, confusing, or difficult like the previous years. But just for the sake of mentioning it as a clinical scenario based question, they have given a scenario, but there were definite exam important keywords which were mentioned, reducing the students' confusion on reaching the diagnosis and giving appropriate answer. So question pattern was not much difficult this time. The only thing which went like against the students' expectation was the number of questions which had come from the toxicology and environmental like emergencies. So questions from Harrison, I think we have already discussed this part. And like finally, I think there is one more question that all the students would want to hear from you, Rahul sir. What would be a good score in this exam?
So I think, Karthik, we need one more day for that. Why I'm saying this is because we need to get the exact options, especially for that toxicology, because I've not got the entire stem of the questions in most scenarios. But again, we'll be coming up with individual subject-wise recalls. I think, once we get a proper structure of those questions, only we'll be able to make a firm statement on that. So I'm just not. But once I actually do the neurology recall very soon, I'll be just going through them, and then I'll be just letting you know what I feel personally, what would be a good score for this exam. Okay, so I'm just reserving it for later, because we are just in the on the day of exam, because again, for so many questions we have not got the the full recall. Yeah.
So I think Rahul sir, this is it. And
Yeah.
like any closing comments from your side?
One query from a student, for the upcoming students, upcoming exam preparing students, should they go for new GTs also? Definitely, you'll be having new GTs. Meanwhile, if you want to start preparation, you can just, try practicing the existing GTs as well. But again, new questions will be coming up. The new series of LI test and discussions also will be coming up. That is what I want all of you to know. But again, once again, I just want to tell you that what has happened today. Was actually the culmination of the months of effort that you have actually put in. So relax, be kind to yourself. Uh, let's wait for the next 2 to 3 weeks, wherein we are expecting the results, and we all hope that you actually get decent results. And fingers crossed. And we'll be coming up with the detailed recall videos in the same YouTube channel. And once again, Dr. Karthik, if you can just show the Instagram QR code, that page, wherein if the candidates who are not there in our WhatsApp group, you can just WhatsApp me personally in Instagram. I'll be sending you the link to join the individual WhatsApp groups of the DocTutorials as well. So this is the Instagram link of myself, Dr. Karthik, and the DocTutorials SS page. You can stay tuned to this. The announcements of the individual recall sessions will be made in this particular page. Okay. Thank you so much, everyone, for joining, and thank you so much, Dr. Karthik, because Karthik has done within a short period of time. You know that we have got only a few hours, and we have come up with almost the entire 150 questions Dr. Karthik has collected and has segregated. So, and I think for the future aspirants as well, this would be actually helpful, at least to have an overview on how the questions have actually come. So that's it. That's our, that's the end of the session. Thank you so much, everyone, for joining. Thank you, Dr. Karthik. Okay.
Thank you. Thank you, sir.